Show today. We have a group that is here to talk to us, and they are going to give us a perspective. America's Heroes Group Roundtable. We are globally connected with Kaiser Health News, and today is Saturday, August 1st, 2020. August is National Wellness Month. And we have our host, as I mentioned, Cliff Kelly. I'm the co-host, Colonel Dr. Damon Arnold, executive producer Glenda Smith, and digital media producer Manny Carazari, and assistant media producer Titus Williams. Saturday's topic for today is with a panelist who's calling in. Our panelist is Stephanie Stapleton, senior editor, has 20 years of experience covering healthcare. She started with KHN when it launched in 2009. Prior to this, she was a reporter and then health and science editor for the American Medical News. She has a master's degree in journalism and public affairs from American University and is a native of Ohio. We'll be discussing Biden is right. Pay for home health workers is paltry. Welcome, Stephanie. You can give us an idea of what is going on with the issues surrounding home health workers and why their pay is so low.
Oh, well, thank you so much for having me, first of all. But a little background on the piece that you're mentioning. I wrote this at Kaiser Health News. We have a partnership with a news organization called PolitiFact.
Yes.
And it's a fact-checking organization which is kind of, designed to check facts that notable people say and, just kind of ferret out if there's some misinformation or explore some of the statements and what the underlying factors are that are at work with that statement. So the story that you mentioned was actually a fact check that came from a speech that former Vice President Joe Biden made earlier this month. It was when he unveiled the third plank of his economic policy. It's called Build Back Better. And that plank actually focused on some initiatives that he's proposing regarding caregivers. And in that context, his exact quote was, he was speaking of caregivers in general, but he said, and I quote, "They're doing God's work, but home health workers aren't paid much. They have few benefits. 40% are still on SNAP or Medicaid." And we thought that 40% was a pretty striking number, so we wanted to dig into it. So that's sort of the background on that story.
Oh, interesting. So what did you find?
Well, we found that Biden was actually, definitely on target with the 40% number. We sort of ran the facts down with an organization called PHI that tracks home health and direct care workers and is sort of a group that studies that workforce and also provides advocacy for them. And they told us that he was indeed within the ballpark. And then some additional reporting that I did found that he may have even been a little bit on the low side, that, there are other numbers that suggest that the number of home health workers and also some of the data I saw grouped home health workers in with direct care workers, which can also kind of include the personal home aides. But there's a fair number of people in that workforce that rely on public assistance.
Oh, Cliff, you want to jump in? Because I know you are ready to talk about this one.
Dr. Arnold, you're great.
Okay.
You really are. Yes, great guest, Ms. Stapleton. And the major problems, as the doctor was mentioning, Dr. Arnold, and it's something that hopefully is going to be worked out because there's so much going on now with this coming up and of course we all know what's going to happen relative to the politics of it. But at this point, what do you see? What's going to be the result of this whole situation as we see it right now, Ms. Stapleton?
Well, I mean, it would be hard to say exactly what, I mean, So Joe Biden has clearly made this a priority, but there's a lot of steps between now and when he could act on that priority. So I guess that would be the first thing to take into consideration. He did consider caregivers in general and home health workers in specific to be an important part of his economic plan. I was kind of reviewing some of the information, and I reread the speech that he gave, and, he considers this workforce to be, the cost of the proposals, which he unveiled, it's about a $775 billion they call it investment. It could also be an expenditure, depends on how you look at it. And they consider this workforce to be sort of shovel ready, that because it's already there, they'd like to sort of infuse money into some of the programs that support that workforce.
I see.
Mm-hmm.
Yeah, that's interesting. Colonel, what do you think?
Yeah, this is really a very interesting subject, especially now that we're facing this COVID-19 crisis, and it's affecting specifically, people who are senior citizens who have, cognitive impairments and physical disabilities, and those things that they have to contend with on a daily basis. And when we talk about these, care workers, we're talking, in general, we have to talk about personal care aides and home health aides and then nursing assistants. And I'm not even sure if that even includes community health workers. But right now, especially with people not going in for their regular routine care, it seems like this virus is going to make even, chronic conditions even worse for people potentially coming out of this picture. So I'm wondering, do we need to have these people who are, licensed or trained, or how do we develop this workforce for the future since we're going to have such a great need? And is there a need to start putting legislation out there for it?
Well, that would be, I can only sort of speak to what my reporting indicated for this story, but I would say one thing that came up with some of the sources that I spoke with was that, home health workers are they have historically been underpaid, or it's been a low-paid workforce, and primarily because the reimbursement rates from the public programs like Medicare and specifically Medicaid, as you're a doctor, this, tend to be pretty low. So, that is a problem that's been going on for a long time. I think you brought up the fact that, with COVID-19 going on right now, there's there's a lot of need, and there's also people's sort of life habits have been upset as well. The people that rely on caregivers, whether to provide care for their children or their aging parents or both, the so-called sandwich generation. This is really affecting their ability to go back to work. So it's not only affecting the home caregivers themselves, but also the people that employ them. And so that sort of is why this might have some political interest right now, because that's sort of a real issue for families and workers across the board.
Yeah, for the supplemental nutrition assistance program, that also is a program that's really in dire need of support. And the SNAP program now more than ever, I guess, with the issues surrounding this COVID-19, a lot of people who are out of work, people who are actually joining the Medicaid and retiring a little earlier, the Medicare roles. And so, what do you think we should be doing as people? Is there a way we can get involved in this? And how does this affect the veterans? Do you have any insight into that?
That's a good question. Yeah, go right ahead.
I didn't specifically look into how this issue affects veterans, but to the extent that they rely on home health workers, I would assume that it is something that is very front and center. and definitely on their minds.
Yes, yeah, yeah. Because I know that there are, quite a few veterans, especially those who have been wounded in war. They've, not paid the ultimate sacrifice, but certainly a very severe one for helping to save this country and keep it, protect the country and our rights as citizens. So I think that is something that really needs to, have some support behind it to make sure that those services stay intact. I'm not sure of how they're being affected right now, but we need to have those people, sort of on the playing field to make sure that our people are taken care of, and also, how do we get through this? Is there any way of people, reaching out or getting involved with any kind of organizations that you're aware of that can help to make sure that this issue doesn't just sort of die away? It stays in the forefront because people are suffering every day, and there has to be some way for people to get involved in doing this. And I guess the first thing is, as you were mentioning before, is educating yourself, right?
Mm-hmm.
Yeah.
It's interesting. I can refer your listeners to the KHN website. It's khn.org. We recently had a story about mutual aid programs, which to me was really, really interesting, and maybe some people would like to check that story out. And, while some of these political issues are swirling about, they still have needs in their people have needs in their community, and mutual aid societies, what they do, it's sort of they're very organic grassroots organizations that link people that want to volunteer with people who need help. So, if someone is a housebound person that needs help getting their groceries, or, something along those lines, they can sign up with this organization, and that links them with a volunteer that wants to run those errands. You need your medication from the drugstore doesn't deliver. There's a person that will go pick it up for you. And now that we're in the midst of the pandemic, I think these organizations take care to make sure it can be a contactless delivery. But I would refer people to check out that story on our website. It's khn.org, because I thought that was a really helpful service. And it's as I said, those kinds of organizations tend to be organic and grassroots. So it's there in your neighborhood generally.
Oh, that's really interesting.
That makes a lot of sense. Yeah, that does. Mm-hmm. Yeah, Biden
also,
said.
It's not just for people that need assistance, but if people want to provide assistance. I remember hearing about it in, a story meeting at KHN, thinking like, wow, that's such a cool idea. It's something that you could get involved in, because it's just like, oh, I have a free afternoon, I could run some errands for somebody,
Right.
Right. Yeah, Biden said home health care workers were paid very little, citing a statistic that 40% of those workers relied on public assistance programs like SNAP or Medicaid as evidence, and that's something that we know about. It's exactly what is being talked about now, according to the experts with whom we spoke. With the documents we consulted, Biden accurately described home health care workers' income and their reliance on these programs. So that makes a big difference, right?
Mm-hmm.
Yeah, that's really interesting, because one of the things I was thinking about too when you were talking, Cliff, is is that we've had about 156,000 deaths from the coronavirus so far, and as a result, that means that there are people who are out there who are taking care of people who are much sicker than they usually are, and they have to actually dedicate more time than ever trying to take care of people who have chronic medical conditions and who are shut in at home and protecting them. So that is something that's really important, because that means they're being even paid less than what they are putting into this whole process, and they may be spending more hours with people in order to make sure that they are safe. So I'm not sure if Stephanie, if you've heard anything related to that. That this need is being made even worse, or is any idea that you have around that subject? Do you think that now it's
Well,
more than ever?
I actually would sort of go to the other side of the question that you just mentioned, and that's just the fact that healthcare workers in general are, they're put in an incredibly risky position because of their jobs and because there is tremendous need out there. There's a pandemic. It's not just the workers in the hospital who are exposed to people with coronavirus.
Right.
Home health workers fall into that category as well, as do the nurses and nurses' assistants that work in nursing homes. And another thing that we've done at KHN, we have a partnership right now that we're doing with The Guardian. It's called Lost on the Front Line. And that's sort of tracking healthcare workers and, just showing the tremendous toll that this pandemic is taking on our healthcare workforce, which includes, as I said, home health workers. But I looked this morning, and between The Guardian and Kaiser Health News, they've identified and are keeping a database. So far, it's up to 878 healthcare workers who have likely died after taking care or helping COVID-19 patients. They themselves died of COVID-19.
This is horrible. Horrible.
Yeah, and so far we have we've published 164 profiles of those workers, and it's sort of like stunning when you think you can look at the documentation of the lives of these healthcare workers. And so I just wanted to mention that as well, because it is a very serious problem.
Well, okay, thank you, Stephanie. We're running out of time, but we have to have you back. It was gracious having you here. You were a fantastic guest on the show,